My name is Dr. Patrick McGann, and today we will be discussing superior capsular reconstruction for irreparable rotator cuff injury. I'm a board-certified orthopedic surgeon that practices in San Francisco, California. My specialty is orthopedic sports medicine, including arthroscopic surgery of the knee and shoulder. We'll start with a brief introduction, followed by injury mechanisms, surgical treatment, recovery and physical therapy, as well as arthroscopic surgery from a live surgery that I performed. So what is the rotator cuff? The rotator cuff is a set of four muscles that both mobilize and stabilize the shoulder. When the muscles or tendons of the rotator cuff are torn, range of motion is lost and the shoulder function is compromised. The rotator cuff completely covers the shoulder. On the left hand of the picture, you can see the intact supraspinatus and subscapularis tendon. The right picture shows a supraspinatus tendon tear where the tendon has been torn from the greater tuberosity of the humerus. There are several different mechanisms of rotator cuff injury. There are chronic injuries which can occur with repetitive overhead activity, such as what can occur with athletes or manual laborers. There are acute injuries which can occur from throwing, a shoulder dislocation, weightlifting, or a fall onto a shoulder. Patients will often present with pain, loss of range of motion, weakness, as well as night pain. The initial management consists of a clinic visit where we will often get x-rays as well as an MRI. Initially, patients are often treated with anti-inflammatories, rest, cortisone injections, and physical therapy. The goal of conservative treatment is to strengthen the rotator cuff and the muscles around the scapula. On physical examination, patients often have pain with provocative testing, accompanied by reduced range of motion and decreased strength. As you can see on x-rays, there are multiple bony landmarks that can be visualized. A normal x-ray shows a normal articulation of the ball and socket of the shoulder joint. In patients with a chronic rotator cuff tear, there can be superior humeral migration with articulation of the humeral head with the acromion, as seen on the right picture. Again, non-surgical management typically consists of steroid injections, physical therapy, and anti-inflammatories. However, conservative management of rotator cuff tears is typically reserved for patients with sedentary lifestyles who do not need full restoration of strength or function. The surgical management of rotator cuff tears is the gold standard for large rotator cuff tears. The gold standard is arthroscopic surgery, which uses sutures and anchors to repair the rotator cuff in a minimally invasive technique. However, some tears are so large that they cannot be repaired. If this is the case, a superior capsular reconstruction can be performed to restore shoulder function. The indications for superior capsular reconstruction are as follows. For patients with an irreparable rotator cuff tear, which is greater than 4 centimeters and is retracted. For a patient that has failed conservative and advanced arthroscopic surgery. For these patients, it is ideal if the subscapularis muscle is intact so that shoulder function can be well balanced. Typically, patients with arthritis are not a candidate for superior capsular reconstruction. These patients are best treated with a reverse total shoulder arthroplasty, which is a surgery I also perform. So what is a superior capsular reconstruction? This uses a dermal allograft to reconstruct the capsular defect and address the rotator cuff tear. Doing so restores the superior restraint to the glenohumeral joint and optimizes joint biomechanics. It utilizes advanced arthroscopic techniques using bone anchors and specialized sutures to fix the dermal allograft in place. Overall, surgical risk is relatively low. There is a less than 5% risk of infection, stiffness, and nerve injury. However, patients should realize that there is always a risk of persistent pain, weakness, and stiffness, and the need for reverse shoulder replacement in the future. Following surgery, we use a standard recovery timeline. Patients usually return to clinic 1 to 2 weeks after surgery, where we remove the sutures and begin pendulum exercises. For weeks 2 to 6 after surgery, patients are typically in a sling and performing pendulum exercises. From weeks 6 to 12, we do gentle passive range of motion. Around week 12, we begin gradual active and active assisted range of motion. Because this procedure involves the use of a dermal allograft, the recovery timeline is quite long. It can take up to 12 months for patients to exhibit full recovery. This is arthroscopic footage from a surgery that I performed. These first two images represent a shoulder joint with a torn, irreparable rotator cuff. You can see that there are some blue sutures in place. This is from a prior attempted rotator cuff repair, which was unsuccessful. I am viewing the shoulder from the lateral portal from the subacromial space. As you can see, I can easily look into the shoulder joint, and there is absolutely no remaining supraspinatus tendon. This is live arthroscopic footage. In this case, I have already placed 2 anchors medially on the glenoid and 2 anchors laterally on the humeral head. These are the anchors through which I will attach the dermal allograft. This is further along in the surgery where the dermal allograft has been placed in the joint. As you can see, it's secured medially with 2 anchors and it's secured laterally. Posteriorly, I have tied the dermal allograft to the infraspinatus tendon for secure fixation. You can see that the dermal allograft is now nicely covering the humeral head. I am still viewing from the subacromial space in a lateral portal. However, as you can see, I can no longer see into the joint. The dermal allograft is now connected medially on the socket and laterally on the humeral head, therefore providing a superior restraint to the glenohumeral joint. So in summary, arthroscopic superior capsular reconstruction for severe irreparable rotator cuff tears is used to restore alignment and function. This is performed using a dermal allograft from donor tissue. This is performed with advanced arthroscopic techniques. However, with all surgeries, the recovery requires active patient engagement and can take up to 1 year. Thank you.